Join us today in a chat with onco-nutritionist about the role of nutrition in cancer care and recovery. I welcome you all in Bestos Nutrition podcast. I'm Dipali Chaturvedi, and we will be chatting with Dr. Poonam Vaswani, an onco-nutritionist with the experience of 25 years. She's based in Ahmedabad and has handled a number of cancer clients, as far as cancer nutrition is concerned. Now, my first question to Dr. Poonam Vaswani is why onconutrition is so important in cancer care.
Thank you, Dipali. It's my pleasure to be here talking to you about onconutrition. And an onconutritionist is basically a clinical dietitian, but one who specializes in the nutritional care process of cancer patients because their needs are slightly different or they have higher needs than many other patients, or I should say that their needs are slightly different because if you see cancer, it's a disease which is, if we could define cancer, it's a disease which is characterized by uncontrolled cell growth. And we see that malnutrition is very common in cancer patients. And the reason for malnutrition could be ranging from something like, metabolic dysregulation that's happening during cancer, the anorexia or the loss of appetite, the effect of the tumor, or the side effects of the treatment itself. So, all these things put together can lead to very high levels of malnutrition in the patients. And what really happens is because of the malnutrition, the prognosis may not be very great. The toxicity that they face, because of the treatment, that can be higher. And the response to the treatment itself may be much less than it would be if they were better nourished. And we've seen, research has shown that malnutrition actually accounts for 20% cancer deaths. So, a person may not necessarily die because of cancer, but because of malnutrition. So, all this, tells us how important nutrition is in the entire care of cancer patients. And that is the work that onconutritionists do.
You rightly said about the malnutrition, but so are the misconceptions. So, what are the common dietary misconceptions you have encountered since many years among the cancer patients?
Oh, there are plenty of these, myths, I would say. So, you have one myth which is, a breast cancer patient should not eat soya beans or any products made of soya bean, right? Which would be tofu or soy milk or, any of the products which are made from soybeans. Now, this can't be, further from the truth, I would say, because actually soybeans are very rich in isoflavones, which are polyphenols, and these polyphenols are known to reduce inflammation, which we see during cancer. So, it is a completely different, it's a very wrong impression that people have. Then sugar feeds cancer. Now, what happens is sugar directly cannot feed cancer. It can create an environment which can promote the growth of cancer. So there's a little difference in the two things, but people just equate it as sugar will feed cancer. It cannot be as simple as that. Then there are people who have read or heard that, vitamin C is good. Yes, vitamin C is excellent because it's a vitamin that it's an antioxidant. It boosts your immunity. It has a lot of good, it's got a lot of benefits. But there are people who go and take vitamin C intravenously. Now, that level of vitamin C is not required. What we get from our normal food versus what we get, when we take it intravenously, there is a bit of a difference between the two things. So, people have to understand the, disease itself better. They have to go into research. They have to see studies and what of these, their myths, what are these which are supported by studies. That is what we do. We do not just go by what we think is right or wrong. We fall back on research, very verified studies. We go to the correct sites, look for the correct studies. So only then will we know whether, that thought process is right or not. So we have lot of such myths.
That was a very informative answer. Now, moving on to my next question, I have actually interacted with many patients, and what I have observed that most of their problems which they face are due to chemotoxicity. So, are there any specific dietary recommendations from you for the patients going through chemotherapy or radiation therapy?
So there are different kinds of treatments that different cancers require. So for some people, it could be radiation, which will work better. For the others, a surgery will work better. For somebody else, whole chemo treatment will work better. So it depends on the individual. What kind of treatment is planned, what kind of protocol they have been given for their treatment, and each treatment, it cannot have the same side effects, or the toxicity cannot be the same for each patient. So it can vary. Although we know that these treatments can be quite challenging for the body to handle, and the side effects can be pretty harsh sometimes. So, yes, the diet will vary depending upon the individual's requirements. For example, if there's somebody who's got a head and neck cancer, they're going through radiation as a part of their treatment, they may get mouth sores, right? That's very common, and the sores can be pretty bad. They can remain in the mouth, or they can extend down to the esophagus. So you can imagine how difficult it is for this person to eat, with so much pain in the mouth. So we would change the consistency of the diet. We would change the textures of the foods that they're allowed to eat. We would reduce the spices. We would make it very gentle on the mouth. There could be times when, because of the eating difficulties, we can expect that because they're eating so little, they're so scared to eat sometimes. So then we may even suggest putting them on the Ryle's tube. So that kind of feeding will, at least we'll be able to give them a certain amount of minimum nutrition, as compared to insisting that they eat, orally. So mouth sores could be handled in that manner. Then nausea and vomiting is something that is very, very common with chemotherapy, and it is usually pretty bad in the first few days following the therapy. And in this case, we may tell the patients to uh, eat foods which don't have very strong odors, and the taste also should not be very strong. The smells that come from hot foods can be pretty overwhelming for them, so they can cool down the foods and have it at room temperature. These are all strategies that work very well for them. Then, something like ginger has a chemical, called gingerol, which works very well for managing nausea. So they can start have like some ginger based foods through the day. It could just be a gentle ginger tea. It could be a nimbu pani with some ginger in it, some green tea with ginger infused in the water. So, or they could keep a piece of ginger in the mouth. So there are so many ways of handling this nausea and vomiting. They could have low hemoglobin levels. Now, there we can work on the diet, give specific foods which can help to increase their hemoglobin levels. Because, unless the hemoglobin really drops very low, they do not need to go towards transfusions. But if their hemoglobin starts dropping, their next treatment gets delayed, their next chemotherapy may get delayed. So we want to make sure that the patient's treatment is always on track. It should never get delayed. So we have to keep watching their blood counts and things, so that they do not drop so low that they cannot go through the next round of therapy. So these are all strategies that we use, and food can be used as a huge strategy for maintaining these levels, blood counts, and all, so that their treatment is not delayed, it stays on track, they feel more comfortable, and they have a better prognosis. Another thing is their weight. we should never allow, I mean, we should try our best to ensure that the weight doesn't drop too much. We see that in cancer patients, most patients would have at least a 10% weight drop, weight fall, weight loss compared to, their normal weight. So, between diagnosis, or rather, cancer has been developing, and then when they go for their diagnosis, we see almost a 10% loss of weight. Sometimes that is the, indicator that something's going wrong. So all these things can be managed well through the diet.
Right. You just mentioned about the polyphenols for the management of chemotoxicity. And I'm aware that many polyphenols comes from many herbal teas and supplements. So what is your approach in your practice about the use of supplements in the cancer patients?
So, we have guidelines, right? Now, how would one decide which supplement we should give to any patient, cancer patient or otherwise? Right now, the first thing that one can do is actually go through blood tests, right? So, what people are very familiar with vitamin D and vitamin B12 tests, right? When we do our body profile, these are two tests that one can include. I am very particular about making all my patients go through this vitamin D and B12 test. Vitamin D is very closely related to immunity and inflammation and cancer. So we need to do that correction. So that is a test which can tell us what the current levels are in the body, and we will not just randomly supplement, because these can be, they can cause toxicity if, we overdo the supplementation. So we need to be very, very clear why we are supplementing. Only if there is a shortfall, only if we are seeing low levels, then we should supplement. So we do a test first, see the levels, and then supplement. So that's one way to do it. The second is we have guidelines, we have a lot of research which tells us that, this is what, these are the kind of vitamins we should look for, these are the supplements that work well. For example, I use a lot of your omega 3 for my patients, right? Now, why omega 3? We have ample guidelines, international guidelines, Indian guidelines, like we have the IAP and the 2022 guidelines for cancer. And very clearly, it's mentioned that omega 3 has a beneficial effect on managing inflammation, right? So when we know that inflammation can come down, and in cancer we see a lot of inflammation, we do a lot of inflammatory marker tests also. Again, that can be tested. We have the CRP test, we have the ESR. We can test and see, what these markers are showing us, and we can reduce the inflammation with the help of omega 3. So that is one supplement that I really fall back on for managing inflammation, right? So one is the tests, second is the guidelines, third is there are enough in ample studies to tell us what supplement may work with which cancer. Use that in fact a lot for my patients who come with arthritis or any bone related issues. So I use that a lot with them also, of course, as an anti-inflammatory as well. But I have to say, something here, that people should be careful, people should keep the doctor in the loop always, because there could be some interactions with some medication, and it's always better to have the doctor in the loop. Most of the times the doctors are supportive of the supplements, and they tell the patients to go ahead. Sometimes they may say, okay, let's wait for a couple of weeks, or 3-4 weeks till so and so procedure is over. Sometimes, these supplements can, some supplements can even reduce the blood clotting. So if they are going to go through any surgery soon, then if the blood is going to be too thin, then that can come in the way of the healing after the surgery, right? So we may look at one aspect, but the treating oncologist is looking at other aspects. We should be together and work on the patient's benefit, together. So it's always better to keep the treating doctor in the loop.
It is very clear from whatever you have said that a role of an oncologist and a diet by onconutritionist should go hand in hand for the good recovery of a cancer patient. Now, considering cancer is a very difficult subject emotionally and physically, so I'm very keen to know that what actually inspired you to become an onco-nutritionist. Can you share some memorable experience with us, which where the nutrition has made a significant difference in the recovery of a cancer patient?
So, yes, I have a personal reason for that. Some years ago, my mother was discovered, diagnosed with colon cancer. And that is where, while I was caring for her, I got extremely interested in onco. When I was studying, I studied in Bombay in Nirmala Niketan, and we needed to do an internship in a hospital. And I had the opportunity at that time of visiting Tata Memorial. I could have done my internship there, but I did get a little disturbed. I was very young. I did get a little disturbed, and then I decided to go to KEM and do my internship. But there is something called destiny, and when my mother got diagnosed, I just went wholeheartedly into the subject. And I think there is a little empathy that I can give to my patients. And since I have seen her so closely going through a lot of stages, and if we talk of nutrition, I have even seen, at that time she had taken TPN, total parental nutrition, at home. We managed her at home with TPN. So these are not things that one sees every day, and very few patients can be treated with TPN at home. But since I was around, the family also had a lot of confidence that, okay, she knows what she's doing, she knows how she can handle it. And that is how my journey towards onconutrition started, honestly. No, I lost my mother 2 years after the diagnosis. Of course, the doctors she was unfortunately diagnosed at a very late stage, almost stage 4. And, she was totally symptomless till then. And the first time that she faced a symptom, at that stage, it had reached stage 4. So the doctors had given her 6 months from the time of the surgery. But she pulled along for 2 years, and after 2 years, I think only the last 2 months were a little difficult for her. But she went through 2 years pretty well, and I feel that the care that she got, not only in terms of nutrition definitely helped her, but even the family support and the emotional support that she got at that time, I think that went a long way in her healing process, and it gave her a good quality of life and extended her life in a good way. I mean, it was with a good quality. So when we talk of cancer, nutrition is there, the medical treatment is there, but there are a lot of other things that we often forget, which is the emotional part as well as the family support that the patient is getting. So we talk of integrated care, which is of prime importance with a disease like cancer.
Lot of advancement has happened in the field of science, but this particular subject of cancer, this disease, is still not curable. So, what do you think? How do you see the field of onconutrition evolving in near future?
Correct. So, just today somebody asked me this question, that can you treat cancer with just food? So, see, I would not put it as simply as that. That without food, your treatment is only partly done. But I would not say that keep your medication aside and only look at food. They go hand in hand. Without food, the treatment is incomplete, medical treatment. And if you're on medical treatment, you need the support of food. So it is something that goes hand in hand. And if we see the number of cancer patients which are multiplying, I have been going to this cancer hospital, which is a government cancer hospital. I had visited somebody there about 20 years ago, and the footfall that I saw then, and then the footfall that I saw 5 years ago, and the footfall that I see today. I mean, I just by standing there at the reception and watching, you can make out what is happening, and then a massive increase in the number of patients. One thing is that the screening is better, the testing is better, so larger number of patients get diagnosed. But then if it's an early diagnosis, which also means that it's very good, because there are very very high chances of getting completely cured and going into remission. So we see that the numbers have gone up tremendously, and it's not only about the numbers increasing, but patients have realized that any disease, when a patient goes to a doctor, the first question that the patient, after medicines and all have been prescribed, they'll ask, क्या खाना चाहिए, हमको खाने में क्या खाना चाहिए. They all want to know this, right? Do doctors have the time or the knowledge to tell them about food and the challenges that come up every day? So when I have a patient, I cannot give a diet like in a weight loss diet. I may give a diet and tell them, come back after 2 weeks and we'll talk again after 2 weeks we'll do a follow-up. With my patients, I do a lot of online consultations, and they are very happy to do it because that makes life much easier for them. So I cannot tell them, come back to me after 2 weeks. They've gone through chemotherapy. They are having so many challenges, extreme constipation, extreme diarrhea, extreme vomiting. In that, I can't tell them, come back after 2 weeks. They need continuous hand holding, and they will come back repeatedly to ask you. So they have this faith that there is somebody who's helping me with every single symptom that I am going through with what I can do at home, right? So there is a set of medicines, SOS medicines, but we try to do whatever we can with food. So there is a continuous support that they require, and doctors are happy to, tell them to talk to onconutritionists, because see, if they are able to maintain their weight, they are able to eat well, they are able to keep their health going, it helps the doctor because they are able to give them the optimal treatment that they have planned for them. So there is a realization, there is a recognition now that without nutrition, the treatment is incomplete. And patients, doctors, everybody is now open to consulting with a nutritionist for that.
Totally agree. Right from people to oncosurgeons to oncologists have realized the significance of nutrition when it comes to cancer treatment. Now, coming to my last question, I would like to ask what one piece of advice which you would like to share with the general public that they should follow to support their overall health to reduce the chances of having cancer.
So it's very difficult for me to give one piece of advice for food. So one thing is, always maintain your weight. It should be in the normal range. Reason being, obesity itself is a big risk factor for many cancers. I'll give you an example: breast cancer, pancreatic cancer, endometrial cancer, colorectal cancer. These are all, they all have obesity as a huge risk factor. So, something as simple as maintaining your weight, which means obviously eating right, eating less red meats, eating more plant based foods, because all our antioxidants come from plant based foods. So, these are things that they can do. They can use healthy cooking methods, because excessive frying and refrying of foods in the same oil, then eating unhealthy fats, all the junk, all this is, why is the incidence increased? Somewhere it's our food, somewhere it's our lifestyle, somewhere it's lack of exercise. All these things put together have increased the risk. So, your lifestyle as a whole will reduce your risk. And, another thing that I would like to say is, don't get scared of screening. It's very important to screen, because the earlier you detect the cancer, the higher are the chances of getting completely cured of it. Get a screening done, the women, if they get a mammogram done, what if something gets detected, and then cancer is considered as a death sentence, which is it is definitely not. I mean, of all the patients who come to me, I think 90% get cured, maybe more than 90%. As the days are passing, the more and more patients are getting cured. There are such fantastic treatments available now. There is so much research in cancer.
That was an eye opening discussion which we had. It was a highly interesting and informative session with Dr. Poonam Vaswani. I also want to thank Dr. Poonam Vaswani for trusting Bestos Nutrition's omega 3 curcumin and chamomile. Also request to share just few final words for Bestos Nutrition.
So thank you so much, Dipali, for having me over. And yes, I have trust in Best Source products, and I wish you all the best and keep coming up with the best products like you have been doing. And you do have a whole range of products which can be used, for general health as well as for cancer. So I am completely with you, and I will continue prescribing your products. Thank you so much, Dipali.
So that was Dr. Poonam Vaswani, a onco-nutritionist from Ahmedabad. And the takeaway from the entire session is that nutrition is very, very important when it comes to onco treatment under the guidance of a specialized professional onco-nutritionist. With that, I end the session today of this podcast of Best of Nutrition. Thank you for joining us and keep waiting for our next podcast.